Connect me to the Wi-Fi to make sure that we can.
Hey, this is Dr. Cree. Thank you for coming to Dr. Cree and me. Tonight we're going to talk about our yearly physicals really needed. I want to first say a very, very, very big thank you to D&D Live. Yes, they are. We're broadcasting live here at Dr. Cree Facebook page, and we're also live on D&D Live, their Facebook page. They are the voice of the people, and they are located at the Plug Radio Network. They have an app. Make sure you go download their app, and it is going to be awesome. They do a show every Friday night, from 7 to 9, various topics. They're located here in Birmingham. Again, thank you, D&D Live, the voice of the people, for airing us tonight as well. So we're here on Dr. Cree page, and we're also on D&D Live, and they broadcast all over. So I'm Dr. Cree. Thank you for coming. And tonight we're live from Brownstone. Yes, I'm still at work, people. Anyway, so tonight we're going to talk about, hey, Roxanne, I see you there. Tonight we're going to talk about if you really need a yearly physical or not. And the answer is yes. Yes, you do need a physical. Yes, you do need a yearly physical. But you can't go to the doctor and say, I need a physical and I want you to check for everything. Insurance will not cover that. So first of all, it depends on your insurance carrier on exactly what they'll cover. So if you have Medicare now allows you to have one physical a year. And on that physical, we can also talk about your other comorbidities or the other health problems that you have during that time, which is okay. However, if you have commercial insurance, Blue Cross Blue Shield, Cigna, Viva, you can have a yearly physical, but the yearly physical comes without complaints. When you're there for the yearly physical, you do not pay a copayment. So you can't come and say, I'm having my physical, which is a $0 copayment visit, and then complain about 10 other things as well. You can't do that. You actually can only have your yearly physical, and on that we'll do screening opportunities. So we'll talk about things like, when was your last mammogram? Did you know that you can have a baseline mammogram between the ages of 35 and before 40? Hey, Dr. Taylor, Dr. Brenda Taylor's on board. She's a great OBGYN doctor. And if you're looking for a GYN, check her out. If you need a mammogram, you can holler at her. And the screening mammograms start at 40 years old. You can do those once a year or once every 2 years. So I think it would be best if you did it once a year, especially if you are African American. You can also have a pap smear done, and that's also once a year. The rules have changed vastly, and Dr. Taylor, you may want to add weigh in, but before you can have your pap smear, usually it was like at 18 years old, have your first pap smear. Now the rule is 21. But I tell everybody, if you're having sex and you're not 21 years old, you still need to get a pap smear. You still need to be checked. Insurance also pays for young women to have a gonorrhea chlamydia test once a year. So pap smear should be yearly. Now, if you are 30s and over, a lot of the recommendations are you can go to every 2 years if you've had negative pap smears in the past and never have had a positive. But you can see your family medicine doctor for that, or you can also see your GYN doctor as well. Like I said, Dr. Taylor is down at St. Vincent's, Birmingham, and she does a great job. Hey, Latonya, I see you saying hey. Oh, and Miss Garner there. Hey, Miss Garner. For Aetna, yes, Roxanne, these are going to be the similar rules that I'm talking about are for commercial Blue Cross, Aetna, Cigna, similar things. So we're talking about mammogram. If you're over 40, getting them once a year. Pap smears, getting them once a year. And even if you go to that every 2-year model after you get in your 30s, you still need to see your GYN once a year for just a regular bimanual exam where they go in and feel your ovaries because you have to make sure you don't have ovarian cancer That's a part of the screening that she'll be looking for, feeling your ovaries and just making sure that the vagina itself looks fine. And that is also done during the times you get your pap smear. All right, so you cannot just get a blood sugar check. Insurance will not just pay for you to have an A1C done. The hemoglobin A1C is the average over of your blood sugar over 3 months. They do not pay for it unless you have had an elevated blood sugar in the past. So if your blood sugars went up before, yes, we can check the A1C. But on your physical, a lot of the insurances want us to do a yearly cholesterol level, depending on your age, and a blood sugar level. And then from there, if your labs are abnormal, usually the doctor will call you back and say, hey, can you come back and we need to check a A1C now that your blood sugar has been elevated. So then that covers the billing from that regard. So cholesterol can be done once every 3 years, once a year. It's just going to depend on what other history that you have. So we talked about mammograms, talked about pap smears, talked about blood sugar. So even if you're diabetic and you're there for your yearly physical, you can't check your A1C during that time. If we do, it's considered a separate visit. So you can have your physical separate visit, but you're going to have to go out to the front desk and pay your copayment. And no one wants to do that. You want this to be a copayment free visit. So men starting at, if you're African American, starting at 40 years old, you need to be getting your prostate examined and the lab checked. And you do that once a year because African American men are at risk for having prostate cancer. So I usually check that every year, and a normal level is 0.4 to 4. However, if as an African American man, if that number is up to about 2, I go ahead and refer you to the urologist because that means we're kind of trending up, and we want to be more preventative as possible. And if you are trending towards some kind of cancer or enlarged prostate, in that regard, we want to be on the forefront of it and get ahead of it before we are behind it. So bone scans. Bone scans are covered if you are over the age of 62. They're also covered if you are on long-term steroids. Say, for instance, if you have problems with your breathing, you have COPD, asthma, or lupus, or rheumatoid arthritis, any of those disorders where you have to be on steroids often, you're at risk for having thin bones. So the bone scan is you go through like an x-ray machine, and then you they check the strength of your bones, and it'll come back and it will say your bones are either thin, they're normal, or they're brittle. And the brittle bones is the osteoporosis, and we'll treat accordingly. But they only pay for that to be done once every 2 years. So mammogram, like we said, once a year, starting at age 40, or you do a baseline between 35 and 39. Especially if you're African American, you and us women, we do need to get that baseline mammogram during that time. Pap smears are once a year until you get to the age of 30 or above. And if you have had all negatives, you can have your pap once every other year. But that doesn't mean to bail out on your OBGYN visit. See them yearly so they can make sure that your ovaries and your skin and areas down there are intact. Cholesterol, we can check once a year if you have the family history, if you're at risk yourself, it's been elevated in the past. If not, if you've been normal, the insurance will pay for it. Okay, I'm back. Sorry, y'all. Then the prostate screening is for men, and we can do it once a year starting at 40. Bone scan is at 62 years old, or if you're on steroids for long periods of time, we can do the bone scan every 2 years. And the big one is colonoscopy. Colonoscopy should be done at 50 years old. You get it, and yes, it's a lot of stuff to drink, but it's so very well worth it. colon cancer is starting to be more prevalent for African Americans. One of my best friends just died from colon cancer in January, and she was only 36. So you have to be proactive. You may not have any symptoms. So 50 years old, get your first colonoscopy unless colon cancer runs in your family. If colon cancer runs in your family, you will get your first colon 10 years before that diagnosis. So if your mom had colon cancer and she was diagnosed at 40, you need your first colonoscopy at 30. And this is actually the same recommendation for mammograms. If you have a family history of a first degree relative with breast cancer, that would be mom, sister, grandmother, you would need to get the screening 10 years before their diagnosis if it's before the baseline screening. So if they got diagnosed at 60 or 70, you're still going to start getting your mammograms at 40. You still get your colonoscopy at 50. So if you have symptoms, then we're not in the screening area anymore. You would be going to have the colonoscopy for actually trying to see find a cause for your bleeding or whatever symptoms you be having. So colonoscopy, you would get the colonoscopy if normal. Insurance pays for it once every 10 years. If it's abnormal, you can get it as frequently as every year or every 3 years. So 1 year, 3 year, or 10 years is usually on average. If you don't want to do the colonoscopy, which I still think you should, there are some tests that you can do, kits at home, where you can leave a stool sample and it sends it for further testing. If it comes back positive, the newest one is Cologuard. You've probably seen those commercials. If that comes back positive, you have to get a colonoscopy. So at least once in your life, you need to get a colonoscopy. So I think those are all of the main screenings that you have to think about. Just remember that, yes, everyone's insurance pays for a routine screening, but you cannot get everything done at that visit. Say, hey, I'm here for my well visit, and usually with most insurances, it's a $0 copayment visit. And then while there, you say, I'm getting my screening done. You can't have any complaints. You can't say my back hurt, plus I want a physical, because they're not going to have that. So make sure that you're up to date with your mammograms, your pap smears, your cholesterol checks, your blood sugar checks, your colonoscopies, your bone scans, prostate screening if you're a man. Does anybody have any questions before I go? Also, if you have Blue Cross Blue Shield Alabama, there is a preventative website. I don't know if you can see this. They have this sheet online where you can, it's got based on your age, and the different, I'm going the right way, the different screenings. So it talks about blood pressure, cholesterol, blood sugar, the bone scan, colonoscopy, how often your insurance will pay for it, and how often they'll pay for it, and that way you can know, so that if you take this in with you to your doctor, you can make sure the doctor is ordering the right test. There's nothing wrong with that, because a lot of times we may not know what your insurance will allow. So don't feel bad by taking the information. Empower yourself as well as empowering your physician to make sure, yes, you take advantage of your well visit. A lot of your jobs too will, if you have the well visit, they'll give you a percentage off of your insurance or some kind of gift card. So make sure to see if they have that incentive as well. So, our mammogram still required for women past, hey, Ms. Rudolph, our mammogram still required for women past 60. Yes, ma'am, they are.